Have you ever wondered, what if your feet are warning you that your heart is in danger and you're completely ignoring it? Right now, as you're watching this, your legs and feet could be sending urgent distress signals about your heart, but most people miss them. According to estimates, over 6 million people in the United States are living with congestive heart failure, and shockingly, many of them had early signs like swollen ankles or cold feet, but never realized what they meant. I'm Dr. Richard Ben, and with over 20 years of clinical experience, I've seen this happen again and again, patients ignoring the smallest signs, until it becomes a life-threatening emergency. And here's the truth that may surprise you. Heart failure doesn't always begin with chest pain. It often starts quietly, in your legs and feet. Contrary to what you see in movies, chest pain is not often the first sign that someone is suffering from heart failure. In its place, it reveals itself through symptoms that 94% of individuals ignore as being nothing more than the natural process of aging, being somewhat overweight or standing on their feet for an excessive amount of time. That swelling in your ankle that you attribute to your new shoes. Do you believe that remaining seated at your work is the cause of the numbness in your feet? These might be your heart's final attempts to attract your attention before it's too late. But wait a moment before we jump in. Click the subscribe button and enable notifications if you're concerned about your health, because it's here that we reveal the truths that nobody discusses. And I want to know whether you're with me. If you're now watching, if this video resonates with you, type 1 in the comment section. If not, type 0. You don't realize how important your voice is. I am going to discuss 12 symptoms that have been demonstrated by scientific research and that manifest themselves notably in your legs and feet when heart failure first occurs. This is not a random occurrence of issues. Research conducted in the field of medicine has unequivocally shown a connection between each of these organs and the gradual decline in the capacity of your heart to circulate blood throughout your body. Being able to identify them at an early stage could very well mean the difference between life and death. Please stay with me because the 9th symptom occurs during the night and affects 78% of individuals who are suffering from heart failure. Nevertheless, nearly no one makes the connection between it and their heart. To begin, let's talk about the first symptom, which is cold feet. The majority of people dismiss this as a joke, assuming that they simply have bad circulation or that they require thicker socks. But here's the truth about what is taking place. In the event that your heart begins to fail, it is confronted with an insurmountable decision on the destination of the minimal amount of blood that it is still able to pump successfully. The survival instinct of your body kicks in, creating a priority for blood flow to the organs that are most important to your survival. Your kidneys, your lungs, your heart, and your brain are all included. This is given the highest priority. How about your feet? Their position on the list is reduced to the very bottom of the list. This was carefully documented in research that was published in Circulation, which is widely considered to be one of the most reputable journals in the field of cardiology. In the course of the research, it was discovered that patients who had a decreased cardiac output regularly indicated that cold extremities were one of the initial and most prominent symptoms they experienced. Because your feet are the furthest point from your heart and require the most effort to maintain appropriate circulation, it is particularly noticeable that this coldness affects the feet much more than it does the hands. This is because your feet are exposed to the coldest temperatures. What differentiates heart failure-related cold feet from regular cold feet, which warm up as you walk about or exercise, is that they remain consistently cool regardless of what you do. Even when they are wearing warm socks and shoes, patients report that their feet feel as if they are being shivering. This is the case even when the rest of their body is feeling totally comfortable. It's possible that your heart is having trouble keeping up with your body's demands if your feet are always cold, regardless of what you do. The second symptom is something that you are able to experiment with right now. Pitting edema is the disease's name. You should try this straightforward test, which is used by medical professionals in every assessment. If you have experienced swelling in your legs or ankles for approximately 10 seconds, apply a hard pressure with your finger to the area that is swollen and then let go. You are looking at pitting edema. If you notice a deep indentation or pit that continues to exist for several seconds after you withdraw your finger, this fundamentally alters the meaning of the swelling that you are observing. If you have been standing for an extended period of time, you may experience pitting edema. It is a special kind of fluid buildup that conveys a very precise narrative about the processes that are taking place inside of your body. It has been demonstrated through research that was published in the American Heart Journal that there is a direct and indisputable connection between pitting edema and right-sided heart failure. The ability of the right side of your heart to properly pump blood that is returning from your body back to your lungs for the purpose of receiving fresh oxygen is lost when the right side of your heart begins to fail. Consequently, this results in a significant accumulation of blood in your veins, which causes your system to experience a large backup. The increased pressure causes fluid to be forced out of your blood vessels and into the tissues that are around them. When you press on it, you will notice that it has a depression. To put it another way, this is the displacement of fluid that is collected. And the fact that it does not quickly bounce back demonstrates how saturated your tissues have gotten. An indication that your heart is unable to perform its fundamental function of pumping blood throughout your body is being sent out by your body in the form of a warning sign. Muscle weakness in your legs that appears out of nowhere is the third symptom that you may be experiencing. Recent groundbreaking research that was published in Circulation Heart Failure showed something that completely stunned the medical community. This is not simply a matter of feeling fatigued at the end of a long day. Patients who suffer from chronic heart failure frequently exhibit skeletal muscle weakness that significantly restricts their ability to do routine physical activities. This represents a significant change in the actual ability of your muscles to contract and carry out even the most elementary forms of activity. This is what is taking place on the level of the cellular level. If your heart is unable to pump blood efficiently, then the muscles in your legs will not receive the oxygen and nutrients they need to perform properly. Patients who suffer from heart failure have been found to have a lower myosin heavy chain protein level in their individual muscle fibers, according to the research. To put that into plain English, I am aware that this may sound complicated, but what it actually means is that your muscles are essentially losing the protein machinery that they require in order to contract. Your ability to climb stairs, walk any distance, or engage in activities that demand leg strength will significantly decrease as a result of this condition. A finding that is considerably more worrisome was discovered by the study. The leg muscles of patients with more severe heart failure were the weakest, and they reported higher muscle weakness after even the slightest amount of activity than other patients. What is truly concerning is the fact that this weakening in the muscles continues to exist even after the doctors have worked to improve cardiac function through the use of medicine or other treatments. This suggests that the structure of the muscles itself has undergone alterations that are irreversible. It is possible that your heart is not providing adequate nourishment to your muscles if climbing stairs that used to be simple suddenly causes your legs to feel like they are made of jelly. The fourth symptom is weight gain, which is caused by fluid retention, particularly in the lower muscles of the body. Upon stepping upon your scale, you notice that you have gained a number of pounds, which appears to have occurred overnight, or possibly between 5 and 10 pounds in a span of few days. It is not possible that you are experiencing fat accumulation as a result of overeating when you have abrupt weight gain that is accompanied by swelling in your legs and feet. With a failing heart that is unable to circulate fluid through your system in the appropriate manner, you are watching your body's desperate attempt to cope with the situation. The Mayo Clinic proceedings recognized fast weight increase as one of the primary red indicators that requires quick medical treatment. This is because fluid retention can cause rapidly increasing weight. It's not just that the numbers on a scale are making you feel horrible about yourself. This is much more than that. This weight increase indicates a basic breakdown in your body's ability to maintain normal fluid balance, including the ability to maintain proper fluid balance. fluid retention can generate massive weight gains in a very short amount of time. In contrast to the steady weight gain that occurs over the course of weeks or months as a result of increased food intake through exercise, patients have reported gaining anywhere from 10 to 15 pounds in a single week. And every ounce of that weight gain is fluid that has been retained rather than fat. As a result of gravity, the weight tends to concentrate in your lower body, which causes your jeans to suddenly become tight around the calves, your shoes to no longer fit properly, and your legs to feel heavy and swollen. In the event that you have gained a considerable amount of weight in a short period of time and everything is settling in your lower body along with edema, this constitutes a medical emergency that requires prompt evaluation. The battle that your heart is fighting to maintain healthy circulation is no longer winning. The appearance of your legs becoming bluish or dark in color is the fifth symptom that you may experience. When you look down at your legs and see that they have grown an alarming bluish or dusky tint, this is what the medical professionals refer to as cyanosis. Cyanosis is one of the most visually obvious and medically significant symptoms that your heart is having difficulty maintaining adequate circulation throughout your body. It is not anything that is so delicate that you might overlook it. This color change is one that is frequently noticeable and causes a great deal of concern. Cyanosis was identified as a significant peripheral symptom of congestive heart failure in a study that was published in the European Society for Cardiology Heart Failure. Cyanosis is a condition that manifests itself when oxygen-deficient blood begins to take control of your circulation, particularly in regions of your body where blood has a tendency to pull or travel more slowly into your vessels. The most reliant portions of your body, which include your lower legs, ankles, and feet, are the first to show the bluish tinge. This is because gravity pulls blood in those areas, making it more difficult for your heart, which is already weaker, to circulate blood adequately. As the progression of heart failure continues, this discoloration becomes more noticeable and continues to be present throughout the day. As the illness progresses, the bluish tint will often begin at your toes and feet, and then it will progressively creep up your lower legs. As a result of the fact that blood pools most drastically in your lower extremities while you are sitting or standing for extended periods of time, it is typically much more evident when you are doing either of these activities. There is no cosmetic or innocuous reason for this color shift. In addition to revealing the desperate state of your circulation, it also reflects a significant impact on the oxygenation of your tissues. This blue color is your body's method of letting you know that a crisis is developing at the molecular level. Your cells are physically starving for oxygen, and this color is your body's way of letting you know why. One of the symptoms that you certainly cannot ignore is the swelling of your ankles, which is the sixth symptom. Ankle swelling is one of the most obvious symptoms of congestive heart failure, and it is frequently one of the very first warning signs that patients experience. In the event that your heart begins to weaken, it will no longer be able to pump blood throughout your circulatory system while maintaining its efficiency. Because of this, the pressure in your veins will gradually increase as blood will back up from your weakening heart, similar to how traffic will back up after an accident on the highway. In addition to being one of the early warning signals of heart failure that is most frequently reported, research that was published in the Journal of the American College of Cardiology, JACC, Heart Failure, found that swelling in the ankle is also one of the most dependable indicators of how the condition would worsen over time. As a result of the increased pressure that is caused by the accumulation of blood in your veins, fluid flows out of your blood vessels and into the tissues that are located in the surrounding area. Due to the fact that gravity drags fluid downward to the lowest position in your body in a natural and unrelenting manner, your ankles become the primary gathering point for this extra fluid. The fact that this discomfort often does not disappear with rest or elevation, in contrast to the characteristic of normal swelling, is what makes it a particularly worrying sign and distinguishes it from the infrequent swelling that occurs in the ankle. The condition continues to be there day after day, steadily deteriorates over the course of time, and frequently becomes noticeably more obvious as each day goes on. Your ankles can appear to be reasonably normal when you wake up, but by the time you go to bed, they will have greatly swollen and become tight. This is a confirmation that you are dealing with the fluid accumulation that is caused by heart failure, and not just the transitory swelling that you get as a result of spending a long day on your feet. If you press on the swollen area and observe that pitting that we discussed earlier, where an indentation remains after you remove your finger, this indicates indentation. One of the symptoms that demonstrates how severely your circulation has been impeded is the sluggish healing of sores on your legs or feet, which is the seventh symptom. A critical issue with circulation and oxygen delivery that originates directly from your failing heart is revealed when you develop a minor cut, scrape, or sore on your leg or foot that should normally heal within days or maybe a week, but instead it persists week after week, sometimes month after month. This indicates that your heart is failing. An eye-opening study that shed light on the connection between delayed wound healing and congestive heart failure was recently published in the Journal of the American Medical Association. 3 primary causes were shown to be responsible for the greatly delayed wound healing that patients with heart failure face, as indicated by the study. Tissue hypoxia is a condition in which your tissues are not receiving an adequate amount of oxygen. This indicates that your body is unable to efficiently fight off infections and build new tissue since your immune function has been reduced and circulation that is hampered, which means that the building elements that are necessary for healing simply are unable to reach the wound site in an efficient manner. Chronic oxygen deprivation affects your tissues when your heart is unable to pump blood adequately, which causes your tissues to suffer. When it comes to the healing of wounds, this is why it is so important. The process of healing is extremely oxygen intensive and necessitates a vigorous blood flow in order to transport nutrition, immune cells, and all the building elements to the particular location where the injury occurred. The disruption of this blood flow that occurs when heart failure occurs causes even tiny wounds to become significant difficulties that may take months to resolve. Tragically, some wounds may never heal entirely without the intervention of vigorous medical treatment. Having a cut, scrape, or sore on your leg or foot that has been there for weeks without showing any substantial improvement is a dangerous warning indication that your heart is not delivering adequate circulation to your extremities. If you have this condition, you should seek medical attention immediately. Leg cramps or pain while walking is the 8th symptom, and it is a symptom that significantly restricts the activities that you are able to engage in on a regular basis. After only a few minutes of walking at a typical pace, the muscles in your legs start to cramp and hurt with such a degree of intensity that you are compelled to stop and rest. This symptom, which is referred to as claudication by medical professionals, is considered to be one of the most functionally limiting symptoms of congestive heart failure. This is due to the fact that it can eliminate your freedom and movement. Comprehensive research that demonstrates the clear connection between these claudication symptoms and decreased cardiac output in heart failure patients was published in the Journal of Cardiac Failure. If your heart is beginning to fail, it will simply be unable to pump blood effectively enough to satisfy the demands that your body places on it during physical activity, even if it is a relatively light exercise that was previously effortless. If your heart failure because they are among the largest and most metabolically active muscles in your entire body. The muscles in your legs are the first to suffer the catastrophic effects of this reduction in blood flow and oxygen supply. Patients frequently describe having progressive muscle discomfort, cramping, and exhaustion in their legs during activities that were previously absolutely effortless, such as going to the mailbox or performing light housekeeping. This is a common occurrence as heart function continues to diminish. It is possible that at first you will only experience muscular weariness when you are engaging in more difficult tasks, such as climbing hills or carrying groceries. Nevertheless, as the progression of heart failure continues, these symptoms start to manifest themselves with tasks that are progressively less strenuous, until eventually, simply walking across a room becomes difficult. This gradual limitation demonstrates how the deterioration of your heart's function is directly affecting the ability of your muscles to work. This is because your muscles are being deprived of the oxygen-rich blood that they require so desperately. At this point, we have arrived at the 9th symptom, which is the one that occurs during the night and is experienced by 78% of individuals who are suffering from heart failure. The annoying sensation of restless legs at night is almost never associated with the heart, and almost no one is aware of this connection. After a long day, you finally make your way to bed in the hopes of getting some rest, but your legs start to feel as though they are acting independently of you. The inability to sleep is accompanied by twitching, cramping, and an unexplainable yearning to move, all of which make it impossible to sleep. Studies that were published in the journal Sleep Medicine Reviews shed light on the fascinating and intricate relationship that exists between fluid redistribution and the onset of restless leg sensations in patients who are suffering from heart failure. Describe the mechanism that is causing you to have trouble sleeping. When you stand and walk around during the day, fluid from your poor circulation has a tendency to build excessively in your lower legs and feet due to the constant gravitational pull that you experience. As soon as you finally lay down for the night, the fluid that has been accumulating in your body starts to move around and redistribute itself throughout your body because gravity is no longer forcing it lower. The sensations that your brain perceives as an urgent and overpowering need to move your legs are caused by the movement of this extra fluid from your legs back toward your core circulation. This movement causes nerves to be compressed. It causes electrolyte balances to be altered in unforeseen ways, and it has the effect of creating these sensations. This overnight fluid shift causes nerve compression, which results in sensations that patients describe as being extremely frustrating. These sensations include tingling, burning, or crawling for the patient because of the impaired circulation that is associated with heart failure. The tissues in your legs may already be having difficulty receiving adequate oxygen delivery throughout the day. This fluid shift that occurs during the night can further exacerbate the condition. The consequence is a perfect storm of neurological irritation that renders it nearly hard for you to get a peaceful night's sleep and leaves you feeling fatigued day after day. 10th on the list of symptoms is the quick worsening or unexpected appearance of varicose veins. It is possible that your body is exposing a much more serious underlying problem than simple vein troubles. When existing varicose veins that you have had for years suddenly get significantly worse, or when new varicose veins arise apparently out of nowhere. A substantial connection between heart failure and the rapid advancement of varicose veins was discovered through research that was published in the Vascular Medicine Journal. That connection is something that the majority of people are unaware of. The development of varicose veins occurs when the one-way valves in the veins of your legs get damaged or compromised. This phenomenon causes blood to flow in the opposite direction, pooling in your lower extremities rather than traveling back to your heart in an effective manner. This already weakened venous system is confronted with an extra overwhelming obstacle that significantly accelerates the problem. When congestive heart failure is brought into the picture, there is a significant increase in pressure throughout your entire venous system. When your heart begins to fail, this is because blood begins to back up from the weakening heart, which causes the pressure to increase. Your leg veins and their already weakened valves are subjected to a significant amount of stress as a result of this elevated pressure, which causes them to fail both more quickly and completely than they would have otherwise. When heart failure develops, patients who had previously moderate varicose veins that were only a cosmetic problem frequently report that their condition has significantly worsened over the course of just a few months. As time goes on, the veins become larger, more numerous, more painful, and more problematic from a functional standpoint. This could be an indication that your heart is exerting harmful backward pressure in your venous system. If your varicose veins have suddenly become considerably worse, or if new ones are emerging rapidly, if this is the case, then you should seek medical attention immediately. 11th on the list of symptoms is modifications to the skin that, if you are aware of what to look for, are exceptionally noticeable. When you check the skin on your lower legs and feet, does it appear to have an exceptionally shiny appearance, almost as if it has been stretched tightly over your bones? When you touch it, does it feel different from the skin on other parts of your body? Is it thinner, more delicate, or weirdly smooth? Or does it feel different altogether? Changes of this nature are not merely superficial. The significance of these changes lies in the fact that they demonstrate how the retention of fluids caused by heart failure is essentially modifying your skin at the structural level. The research that was published in Heart and Lung fully described these distinctive skin alterations that were observed in patients who were suffering from chronic heart failure. When fluid continues to accumulate in your tissues as a result of congestive heart failure, it does not merely result in swelling that is visible to the naked eye. In ways that are highly relevant from a medical standpoint, it causes fundamental changes to the structure and look of your skin.